everyone. We're going to go ahead and get started while we wait for people to trickle in. Welcome to our workshop, Reframing Conflict, How to Master a Difficult Conversation in Emergency Medicine from a Sex and Gender Lens. I'm sure you all know working in the ER is chaotic, and we interact with many different people, and it can be daunting when you have to negotiate and find out the best treatment plans for your patients. So we're going to learn how to normalize it and how to normalize stress and provide better patient care as a result. So I'm just going to give a brief intro to all of us who put a lot of work into this workshop. I'm Ynhi, I'm at Baylor. I'm the assistant DI director there and assistant medical director. We have Dr. Jeanette Wolf, who's a professor at Bay State. She runs a podcast on sex and why and does a lot of really interesting research on effective communication between men and women in high stress situations. And then we have Dr. Kalantari, who is Vice Chair of Education at the Department of EM at Penn State, who has an interest in stress education, physician wellness, and you'll hear a lot about what she does very soon. Dr. Chari, she's also at Baylor, and her focus is more on health equity and medical anthropology as well. Then we have Menu Samiai at Brown. She's a research fellow. She works with the esteemed Dr. Allison McGregor and does a lot of studies related to sex and gender inequities. Feel free to sit anywhere. Sorry, I don't know what's going on here. I don't know if it's on a timer or not, but it keeps flipping without me clicking on it, and now, here we go. But it won't let me go back. Weird. Okay, Dr. Suh is a PGY2 at Baylor, soon to be PGY3, and she has been phenomenal in organizing this, and her focus is on medical education. And then we have Dr. Doyes from Brigham and Women's Hospital with Harvard Medical School, who's phenomenal. She has a focus on gender equity in academic medicine. And then we have Dr. Bueller, also from Baylor, who's our Vice Chair of Operations and Quality. And of course, we all know Dr. Doss, who's the AWEM president for this year. So this is the learning objectives for today. So we'll first focus on barriers to effective communication in the EM, in this chaotic environment, and then describe how our sex and our gender may affect that. Then we'll practice an intentional growth mindset to how to address that and how to normalize stress and conflict. Sorry guys, I have no idea what's going on with the slides.
Do you want me to look at it?
Yes. Is it? I don't know if it's on a timer. I'm so bad with
sure it is.
PowerPoint. But when I made this, I didn't put it on a timer, so this is weird.
I gotta escape, okay?
Okay.
Sorry, everyone.
So the schedule for today, it's 3 parts. Part 1 is on gender communication and conflict. We'll go over some evidence-based strategies for how to approach that. We'll do small groups and case-based learning to apply some of those principles that will be taught. And then part 2 is a panel discussion with leaders within emergency medicine, and they're going to tell you about their experiences with some tough situations they've had in their careers and how they've approached it, especially from a more sex and gender focus. And then the third part is more experiential, so we will learn about the current research on stress mindsets and how to reframe conflict, and then you'll get to, it's more interactive, you'll get to write a letter to yourself about how you approach a situation in the past and how you might do it differently now.
It's not fixed, is it?
No.
I
because it was on play, so maybe that helps. But I will hand it over to Dr. Dobies for the first part.
Thank you. All right. Hey, a round of applause for tackling this technical difficulty. So it is my pleasure to be here. And my last name is Dobies. It's the hardest thing to say, Valerie Dobies. And it's going. Okay. So I just want to acknowledge this incredible group of people who have put this together. It's really an important topic for all of us. We all deal with communication and conflict every single day. There's probably at least one conflict you probably had today. Who knows what that was, that you had to negotiate and navigate. And in the emergency department, we get very skilled at this, right? We have to navigate and negotiate with consultants, with our nurses, with our APPs, with everyone, every shift, all the time, right? So we do this whether we like it or not, and we become experts at it. Just gonna roll with it. So we're gonna talk a little bit about gender schemas. And there's a lot of identities we can talk about, but how we are interpreted and how we're viewed by our communication has a lot to do with our identity, social norms. There's an inordinate amount of literature, and we'll talk about gender, about how men and women are perceived when we communicate. So men are thought to be agentic, which are logical, they're more independent, aggressive, assertive, and women are more communal, right? We are collaborative, we're team players, we work together. And so these social norms, men and women are socialized this way, to have this expectation, right, about how we're supposed to behave, these social norms. And when we don't, if I come up here and I'm aggressive and assertive and you have this preconceived idea about how I should behave, or if I'm that way in the emergency department. So both men and women are socialized in this way. All right, and that doesn't even, hi, hey, come on over. Yeah, it keeps rolling. So I'll keep going while we're doing that. So now this doesn't even talk about the other identities, the intersectionality. So if we're an Asian woman, or our race, our religion, our ableism, and when we have this intersectionality and expectations with our communication and our negotiation. You okay, Jen? We're gonna get through it. This is about communication. How do we navigate this?
We're all emergency medicine physicians. If nothing, we are adaptable.
We are adaptable. We are flexible. We are. That is exactly right. We can't roll with it. Like we need to just we need to go into the profession. I was about to stereotype other professions about who can't deal with this, but that is wrong of me. That is a stereotype. I'm not going to mention other specialties. So there's this underlying, so the gender element. There are many other identities that we have, but the gendered element of that, and when you don't abide by that, how that creates some conflict. So we should talk about that. This bias, implicit bias that we all have. Every single one of us has a bias about whether it's about gender, whether it's about ethnicity or race, or what. We all are socialized to have these biases, and we have to be aware of that and acknowledge it and deal with it and find a way to do that. So when men and women negotiate, there's a lot of data about this. Women generally, when we negotiate, are not perceived well by men and women. We're greedy. Why is she asking for so much? There's data in the business literature that shows that. But men, they may not like it, but men are perceived, wow, he's bold, he's aggressive, he's assertive, he really is asking for a lot. And it's perceived very differently, so in that.
I think it was this.
Or was it? We think it's a ghost. We've named her Eleanor.
All right, what slide are you on? You can have to do it manually. Right?
We can do we're going to need to deal with negotiation. Thank you. It's all good. It's good. Appreciate your help. What's your name?
Gabriel.
Gabriel, you're an angel. Angel Gabriel. There we go. So, let's talk a little bit for everyone in this room about negotiating. We said that you're going to be negotiating, you're going to have to problem solve each and every day. We do this in our families, in our relationships, and we do it at work. So it's a problem-solving process in which two or more people voluntarily discuss their differences and reach a joint agreement on their common concern. So just putting it out there about what a negotiation is. And the ideal is to have a win-win or a good deal for everyone. And what I would tell you is that each and every one of us has a unique or a negotiation style. And it could be multiple things that we do. Sometimes we're conflict avoiders. Does anybody here hate conflict at all costs and avoids it? They're that. Some people are collaborators. Sometimes some people are very competitive and they want to win and they negotiate like they go all out. So many of us have, and there's inventories we can share with you to know and understand what your negotiation style is. But it encompasses verbal and physical behaviors. I had a lot of issues, I would tell you, early on. I come from a very demonstrative family, and I'm very expressive. And my face gives away a lot. It's like be angry or upset, and I had to learn to control. Hey, Kat, so good to see you. I had to learn to control my physical behaviors during negotiation or during conflict. You know, getting upset with a consultant, my voice would get kind of shaky, and I would have to stop, literally, and count 10 seconds, or I would walk away so the emotion didn't get away with it. Does anybody have that issue of trying to control, or the facial expression, or they can tell? And so that is something I have had to control and reach a level of cadence where I can do that. So what shapes our style? Why are we avoiders? Why are we particularly competitive or want to win at all costs? So it's shaped by our perception, interpretations, our values. The values we put on the facts of the case. Assumptions. So Kat, if you and I are negotiating, not to pick on you, but I totally am.
I love it.
I'm totally picking on you because you're right there and I know you'll love it. So I am going to assume I'm in a negotiation. I want a raise.
No.
I'm getting it. Oh yeah, you don't know, but I'm getting a raise, Kat. So what are my assumptions? She's got a fixed amount of money. She's got to allocate it. She's got to take it away from something else. I'm making assumptions about what she wants. And also really important is your sense of identity, your worth and value, and what you attribute to that. So for Kat, I can be arguing about a sandwich that I want, but for me, I could care less. I don't have much value in it, but for her, it's everything. So we don't always have the same value to the things that we're negotiating. So here fundamentally, it's a little teeny print, but there are, and I'll go over these. These are fundamentally the different negotiation styles that we will use. And we have the avoiders. Okay, so Dr. Clem and I, we are negotiating. I'm a vegetarian, and I don't know what you are, but I'm gonna assume you want a steak. So, I don't know why I made that assumption, but so, if my negotiation style is avoiding, like I know she doesn't want to eat vegetarian, she doesn't like it, she wants a steak. I just don't even engage with her. I don't go out with her. I'm like, okay, I don't want to deal with this, and that's the situation. Collaborate, there's a collaboration. Is we both want, she wants a steak and I want a vegetarian meal. I'm going to find a restaurant where we both get what we want. They serve vegetarian and they have great steaks, so we're super happy. There's accommodating. All right, we can't find a place that has both steak and vegetarian. We're both going to eat something different, and we can find it. An Asian restaurant that doesn't have steak, doesn't particularly have a vegetarian option, but I can find something, she can find something. Compromising is, well, that's compromising. And accommodating is we both find something, it's kind of, we both win, but we both lose, compromising, okay, you know what, I really like you, Dr. Clem, you're amazing. First AWEM president, by the way, does everybody know that? Like, big shout out, right here. You know what, it doesn't matter so much to me, let's go to your steak place. I'll find a vegetarian option. And competitive is like, I really want vegetarian and I don't care. And if we don't go vegetarian, we're, you know, that's it. Like, sorry, Dr. Clem. Yeah, you don't get your steak. So like that's the competitive stance on things. So we went through that. Compete, it's my way or the highway, right? Collaborative, that's kind of the goal, is both of you win. Both of you get what you want. Compromise, neither one of you gets what you want, but you sort of meet halfway. And those are kind of some nice style. We compromise a lot in the emergency department. Accommodating is, okay, I give in. You know, it's not, that doesn't matter so much to me. And avoiding, we don't even engage. Nobody gets anything, and that's an avoiding. Now here, I want to frame this. So we're going to do an exercise, and I'll stop talking, which will be great for everybody. You know, you'll be so happy. This has helped me a lot to think about what strategy. So all of us have the styles that we like, that we go to, that we feel best with. What I would tell you, it depends on the situation. And this is a nice way to go about it. So on the bottom is degree of cooperation. How important is this negotiation? How important is the relationship to you in this negotiation? And on this axis is the degree of assertiveness. How much do I want this? Okay? And so if I really want it, and I don't care so much about the relationship, I need that CT scan now. You're a consultant, I'm not gonna see you again. It doesn't matter to me, it's that patient in that moment, what I need to do. We're getting the scan now. I know you don't wanna do it, but I'm gonna get it. So if you can frame this works in your personal life, this works in your professional life, the importance of the relationship and the importance of the issue at hand. And then you navigate on, you know, if you don't really care about the issue and you don't really care about the relationship, you don't even engage in the situation. If you care a lot about relationship and building and working together, then you find a way to either have a win-win or a lose-win on that degree of things. So if you can frame this and think about the context or the issues at hand, I think this is very helpful. It has helped me.
May I ask a
Oh,
question?
yes, of
And
course.
perhaps you will get to it.
Yes.
But this chart that you have up, I love it. It's also dependent on the other person's willingness to engage, correct?
Correct. So always a negotiation from the beginning is two or more people that are agreeing, you know, are entering into this discussion to come up with a common, you know, solution, right? So what do? That's a whole other step if someone is not engaging with you, right? That's not really a negotiation. You know, if Kat's my boss and I go in and I want to negotiate, I think I should have, you know, more resources. I need more, you know, for grants. I need help. And Kat said, won't even give me an appointment. And it's like, we're not talking. You know, zip, zip. That's not a negotiation, right? So negotiating, Kat's willing. Dr. Ogle says, come into my office. I want to hear what you have to say, and there's a dialogue, and there's some give and take. So negotiation takes two or more people to have that, right? Does that make sense? Mm-hmm. This is when you've engaged in a dialogue, and you want to determine what your strategy and what might be the best in that situation. So I care a lot about this relationship because I want the job. I want to get advanced, I want to be promoted, so I care a lot about this relationship. So I'm not gonna take a compete, like, or I have to have a BAFTA, I have a best alternative strategy to this. Like, if I go in and a compete, and I give an ultimatum, I better have a plan, an alternative solution. Like, I better have gone to Baylor. They got a nice group there. I think I would go to Baylor. But anyway, they're doing all kinds of awesome things. So, and that I have a job offer, and that I have an alternative. Because if I go in and say, listen, if you don't give me this, I'm out of here, you better be out of there, right? You better have thought that through. So if that makes sense, negotiating is a dialogue, is an exchange that you're doing. So when to use which style, here's a general, when you lose. This happens in the emergency department. This is quick decisions. This is when you have to be decisive, and you need it immediately. There's no negotiating. We do this. Even if you're an avoider, some of you raise your hand, you're an avoider, you have to do this. There are times where the nurses or the people around you are saying, oh, I can't. Well, no. This patient needs this, right? This is the sickest patient in our department, and this is what needs to happen. And you may harm that relationship in that moment, but that's what needs to be done. So that's a strategy that we use. I win, you win. Dr. Clem, I want to be on her good side. I really respect and admire her. So I'm going to work hard to find the win-win on this one. So a lot of, the relationship is very important, and so is the issue at hand, to find, this mutual beneficially thing. And this you may have to do a deeper dive into what their perspective is. Like, we make assumptions. This is where you need to do your homework and figure out what the other person, what their interests are, where they're coming from. So compromising, is a time where it's kind of in between. There's limited time, but you have a trusting relationship, and both of you are willing to give up because it's that value of it. It's not so important to either one of you. You're willing to compromise a bit. And accommodating, I think we do this a lot in our families, and we do it in our department, is sometimes the relationship is so important and the issue is not so important to us, we acquiesce. Okay, if it may not be the way we want to treat that patient or manage it, this happens to the residents. Those are residents in here. Sometimes you're like, well, that's not what I would do, but that's okay. That's in a realm of possibilities. And sometimes I'll say, could you humor me and order this, the troponin? That would be healthy, but if you justify, you can accommodate that. The avoiding, so those of us, many of us, nobody likes conflict. I'll guarantee you that. Some people thrive but we don't really like conflict. It's uncomfortable for us. But if you don't engage and you totally avoid it, first of all, you don't get good at negotiating. You won't win anything, and you won't get your raise, you won't get your promotion, you won't get extra resources if you don't ever engage because you don't want to, or so. And a few last slides. One is a cultural context. We talked about your identity, gender, your race, your religion, and if you have disabilities, but culturally, and region of the country. I now have been transported to Boston, and there's a different culture there. And I grew up in Kentucky, and we talk slowly, and there's a different culture and context. And globally, there's differences. So my mother has a green card, is not from this country. She taught me early that, people with a different, or who have an accent, know at least 2 languages. That's my mentality. So when they have an accent, never make fun of somebody with an accent. They know at least 2 languages. But my family is in the far left upper corner, very expressive, that's why my facial expression, I'm up there with my hands, and I'm like, so I'm very expressive. I grew up in a very confrontational, we talked about politics, we got into it. My husband is of Scandinavian descent. His family, everything's fine, the weather is good. And the most outrageous things have just happened, but they're emotionally unexpressed, and they avoid conflict at all cost. He used to say, whatever, honey, of course, it's my fault. And I'm like, it's not your fault. I'm all up here and he's down here. We have learned and adapted our styles to be in the middle. He's much more expressive, and I am much more toned down, so we can negotiate nicely. All right, last, before we get to this, here are some common pitfalls in negotiation. A failure to prepare. So if I'm going in for salary negotiations, I should know or get a handle on what an assistant professor makes, what does an associate, what is the incoming. You know, I have to do my homework. Are there moving costs that I can ask for? Are there other things that I can negotiate for that aren't just salary? And I would say women have not always been good at this. This is a gendered thing. Wasn't taught how to negotiate. I just took the job without even asking the salary. That's how ridiculous it was back in the day. I'm like, oh, I trusted.
It still happens, not just back then.
I know, well, like, that was a long time ago. But you just, of course they trust them. And then you find out your male colleagues negotiated for other things because they asked, hi, come on in. So prepare. Do your homework about what you're about to negotiate. Don't make assumptions about the other person and where they're coming from. Do your homework. Relationships are very important to the person. Develop those relationships. So when you go in, there's a bit of trust, that you know them and you have that kind of relationship. Talking more than listening. That's huge. You talk, and they don't have a chance. They may have an idea or a thought, something they want to share, but you do all the talking. In this, listen, and I make notes. And I have to hold my tongue. I told you I'm super expressive, so I make little notes. I just write it down, and I keep my tongue, because I want to lash out or I get very emotional. So I just make little notes to myself to revisit or to think about after, and I kind of calm myself. And the emotions getting out of your way. You get and this used to happen a lot when I was a young attending, where I would get very upset and fired up, and it was in my voice, and people, that's all they saw was that emotion, and they didn't hear, even though I had a very legitimate thing I needed to say or talk about, the emotions got in the way. Thinking the pie is fixed and that things are non-negotiable, like your salary. The salary may be fixed, but clinical, non-clinical hours, your title, your space, your resources, there are other things that you can be given and negotiate and do a good job about doing that. Don't ever negotiate by email. It doesn't work. It's terrible. You can't get the relationship building, you can't do it well. So don't start engaging every time. It's going to not be good. I guarantee you that.
I would say follow up your negotiation.
Oh, that's it.
Okay.
Oh, Dr. Ogle, look at you. Oh, okay, and this I learned the hard way, but I'm really good at it, and I've been really good, and it has saved me a lot of times, after we make a decision, I document it. You codify it. Dr. Clem, you promised me, thank you so much for meeting. It was lovely. As we discussed, I will get a 10% raise, and, to begin in, I write it all out, that was the agreement, it's fresh, and it's codified, so always document after a negotiation. To your spouses, your partners, you agreed to do da-da-da-da. No, so codify it. So I would say that's really, thank you. You can give me my $5. Your what?
My $5.
Oh, thank you. I know. There, she gets $5. So what we'd like to do now is we have some real cases that were developed that we want you to think about, that are conflict or opportunities for negotiation, and to think through these situations and thinking of that algorithm, how important is the relationship and the issue at hand, and how might you handle that particular situation. So we wanted to do some interactive, sessions with you. So we'll go, you want to take it away?